That's our WhatsApp line. You can call that line and send in your questions, your concerns, or you just want to make an inquiry. That will be very welcome. I'm sure as the show progresses, my guest, who I will be introducing pretty soon, will be more than ready to tackle every of your questions and concerns. Perhaps you'd like a more visual experience. Yes, as far as you're not the one driving, okay, you can connect with us on Facebook, Lagos Traffic Radio 96.1 FM. This show is beaming live. We're streaming live. Just search for that page, Lagos Traffic Radio 96.1 FM. But please, if you're the one driving, is a no. If you haven't followed us, follow, like our page, okay? Like our page. And of course, every and any time we put up amazing shows, you definitely will be privy to this. One more time, you're welcome to EKO EXTRA Extra. My name is Akan Usen. Straight away on the show, we have a guest. For those who have been following the show, he is a name and perhaps a face that you will definitely have come across before. Yes, in the studio with us to talk EKO coverage and benefits and everything in between, we have Mr. Olusegun Braimo. He is an agent coordinator with LASHMA. You're welcome, Mr. Braimo.
Oh, thank you for having me.
Happy New Year to you.
Oh, same to you.
Yes, of course, dear listener. This is actually our first show. The second show. The first was on the 1st, which was last week, Monday. So this is like the second. But I would say this is the first show where we're having a guest this year. So yes, Happy New Year to you, Mr. Braimo.
Thank you very much. And Happy New Year to all the listeners too.
Great. So we're talking EKO coverage and benefits. So as we go into this topic, let's just let listeners know that around the Dioro end towards Olusha in North Ojuoye, I understand clearing and cleaning of the drainage at that end, which is occupying about 50% of the road. Just a lane is available for movement at that end, and of course that will slow down traffic a bit. Watch out for that as you head in that direction. All right, Mr. Braimo. So I'm sure there's someone somewhere out there who doesn't know what EKO is. So let's start from the very basics, the nitty-gritty. What is EKO?
Thank you very much. So once again, good morning, everyone. And I bring special greetings from our Permanent Secretary, Dr. Emmanuel Azamba, and the entire team of the Lagos State Health Management Agency. So for the benefit of those listening to us for the first time, EKO is a social health insurance scheme that was established by law in 2015 to provide affordable and quality health insurance for every resident of Lagos State. So it's not for only Lagosians, that's indigenous of Lagos. It's not for only the Yoruba people. It's not a tribal scheme. It's for everyone who spends most of their waking hours in...
If you do not actually, say, live in Lagos, if you work in Lagos, you can also be a part of this. Is that what you're trying to say?
Yes, because we have quite a very large... The Mowe side, the Songo side, the Badagry axis, and they also benefit from EKO, provided the hospital they're choosing.
The answer to this. A few people have come up with this question. They say the LASRA registration is now sort of a requirement to come up to be part of this scheme, to enroll. Now, those who stay outside Lagos, how do they now get to be part of this?
Okay. Part of our design is that to benefit from EKO, you must have one means of identification. Which we recommend LASRA. Proving that you live in Lagos.
Because it has most of your data.
Exactly. As a matter of fact, on our ICT infrastructure, you can enter your LASRA number, click verify, and it will bring out all your information. So what we do on our end is just to update. Maybe you've moved from where you used to live, and then you select a hospital. That's mostly what we do. But for those who don't have LASRA, it's not a primary requirement. So it's not compulsory that you must have LASRA.
It doesn't hamper them?
No, it doesn't. It doesn't. Even for those who don't live in Lagos, for example, there are some organizations that are on the scheme that most of their staff live on the Mowe axis. and we use their office address as their residential address.
Great. So since the hospital they're picking is in Lagos.
It's in Lagos, yes, exactly. So that when we want to trace them, we can say, oh, this is where you filled as your residential address. If it's where you work, then if anything happens, we know how to get in touch with you.
Amazing. So for the benefit of our listeners who hearing us for the first time, can we talk about the various health plans that, of course, ILERA EKO has, or Lashma has, and let's just take it up from there. Thank you.
Okay, to make it very straightforward and as concise as possible, ILERA EKO has 7 plans now.
Okay.
7 plans. We have the standard plan, the standard plus plan,
right,
the telemedicine plan, the seniors plan, the school plan for primary and secondary schools, the tertiary institution plan for higher institutions of learning, and the diaspora plan.
Right.
Those are the 7 plans we have. Starting with the standard plan is our basic plan. Up until this minute, the standard plan is still 8,500 for an individual. And
why did you put that up until this minute, that clause?
Let's just say there's something we're cooking up that
great.
very soon.
Okay. So looking forward to that.
So up until this minute, the standard plan is still 8,500.
Okay.
And the family plan is 40,000.
All right.
So 8,000 for an individual, 40,000 for a family. And the family is principal, spouse, and 4 dependents. What we commonly call the father, the mother, and 4 children.
Okay.
However, it is not compulsory that they must be your biological children. So if you stop at 2 and they have 2 other younger ones staying with you, they can also be your dependents still under one family package. Now, for the benefits of the standard plan, it covers from general consultation, meaning you pick your hospital, you have your policy number is activated. You take your policy number to the hospital, you want to see a doctor. That's general consultation, it's covered. To register you in the hospital, that's open a file for you, it's covered, you're not paying anything else.
Okay.
Drugs are covered. However, I can't stress this enough. Not all drugs are covered.
Not all drugs
are covered.
Okay.
Because let's not forget, this is a social health insurance scheme.
Yes.
So we are looking at what will benefit the majority. So there will be some very, very few drugs that are not covered. However, the majority are covered that you won't have to pay for. Now, admission is also covered.
This, of course, is based on data, right?
Yes.
Okay.
Admission is also covered on the standard plan up to 15 days.
Okay, 15 days.
And for each day on admission, 1 meal per day is covered where available.
Okay.
Meaning if the hospital they really chooses is offering a meal.
Such a service, okay.
Yes. Then they'll get entitled to 1 meal, just 1 meal per day. And
the
also,
15 days, is it, or does it have to be back to back or?
No, what we say is 15 days cumulative.
Cumulative,
in a
okay.
year. So if you spend 2 days, you still have 13 days.
Okay.
If you spend 5 days, you still have 10 days.
Okay.
And the days are not transferable.
Okay.
So if
you cannot move it on to next year, so I only spent.
There's no carryover.
Oh, great.
And if daddy has used his own 15 days, he cannot borrow from junior.
Oh, okay.
They're not transferable. Blood transfusion is also covered on the standard plan.
Okay.
I think we added that January 2023.
All right.
Whereby every enrollee is entitled to 2 pints of blood prior to our approval. And part of this we also cover our other tests and scans from chest x-ray, chest and limb x-ray, full blood count, and so on and so forth. Now, another thing that's covered, which is, let me say, kind of like our major selling point for the standard plan,
yes,
is the full maternal care. So from antenatal to delivery is covered on the standard plan, but only for the family package.
Oh, okay.
So if you register as an individual, you cannot access maternal care. Just, you know, access your normal care, and then if along the line you get married, you can just do an upgrade.
Okay.
So we've had people who registered as individual, and within the same policy year, they got married and took in. So they'll just upgrade to the family, pay the balance, and then continue
with the rest
with the same policy number as the family plan. Now, still covered on the standard plan is the treatment and management of chronic illnesses. So like diabetes, high blood pressure, hypertension, sickle cell anemia, asthma, arthritis are covered on the scheme.
Okay.
And it's not just the diagnosis, the treatment, the drugs, and the follow-up treatment is also covered on the scheme. Now, to add a little more, We'll also cover some surgeries,
Okay.
minor laceration, POP application, and it also covers specialist consultations too.
Okay.
So you can see a gynae, you can see an orthopedics physician, you can see a general surgeon within the policy year for 4 visits.
Okay.
So you can exhaust all the 4 visits on one specialist, or you can see all 4 specialists. Pediatrics is also part of the specialist consultation that we cover. However, we know some specialists are peculiar to a particular sex.
Yeah.
A man has no business with gynecologists. Same way adults don't have business with pediatrician.
Yeah.
So for pediatrics, then a child can see a pediatrician up to 4 times within the policy year.
Okay.
Same way a woman can see a gynecologist up to 4 times within the policy year. Now to add
All for those, all of them in that plan. So
Yes.
4.
yes,
Okay,
it's
great.
per enrollee.
Enrollee, okay.
Now to add a little more, I said earlier that it covers full maternal care,
Yes.
from antenatal to delivery,
Yes.
and even postnatal care.
Okay.
So the pregnant woman can give birth on the scheme, whether naturally or by assisted delivery, CS or other forms of assisted delivery, still covered, and they won't have to pay on the scheme. Now, the newborn baby is also covered for the first 28 days of life.
Wow. First 28.
First 28 days.
Okay.
And we believe within that period, the baby would have gotten a name and then can now be added to the policy of the parents.
Okay.
There are so many other benefits I would have loved to explain, but time will not permit us so that we can shed a little more light on the other plans.
The other plans.
But you can always go to our website, ILERA.com or lashma.com, and then you can download the full benefit package of each of our plans to see that.
Okay, so before we go on to the other plans, okay, we're going to be talking about Standard Plus, right?
Yes.
Okay, so let's just take an update on the Ojodu Berger axis. Let's see what's happening at this time. Okay, so I can tell you that it's generally very good within Ojodu Berger at this time. Lagos Ibadan Expressway, inwards and outwards, is good. The stretch of Ogunusi Road, equally good from River Valley to Omole Junction, connecting Agidingbi. Well, of course, we need to consider alternation, which might slow things down a bit, but by and large, it's nothing to worry about. Omole was excellent. Ogba, Oduero, also good aside alternation. However, we have high influx moving out of the Oba Ogunji Road towards Oduero. Wemco in and out is appreciable. The return trip from Oduero back to Omole VIS Isheri Lowura, connecting Lagos Ibadan Expressway, equally good. Well, of course, aside slight traffic alternation delays approaching the major intersections on that stretch. No impediments, and the traffic managers are doing the needful at their various choke points. From our live camera feeds, I can tell you things are looking good. Well, around the Bagada Expressway, from what I can see, okay, the camera around the Newcastle end, for those who intend applying, connecting the Corona Loop thereabout, and those who intend heading in towards Bagada, you have nothing to worry about. Moving ahead, around, Maryland inwards, New Garage via the Odoyalaro Bridge. It's also looking really friendly. Yeah, nothing to worry about whatsoever at this time. Around the Allen end, Allen intersection, well, for those coming in from the low end, trying to connect other parts of the Obafemi Awolowo Way stretch, it's a very, very good one. Of course, we need to consider traffic light alternation, which is a thing, but it's on and off, intermittent. It is still looking quite good at this time. All right, we'll be taking a quick breather, and when we come back, we'll go into the other plans we have on the scheme. Stay close.
This is Shipping Position, brought to you by Lagos Traffic Radio 96.1 FM.
34 ships laden with petroleum products, container, general cargo, and others are expected at the Lagos Port Complex today. The Nigerian Ports Authority (NPA) made this known in its publication Shipping Position. The publication said that the 26 of the ships contain frozen fish, INB, general cargo, PMS, AGO, bulk wheat, bulk sugar, bulk gas, bulk salt, and container. NPA reports that 3 motor vessels are also waiting to berth conveying container, bulk salt, and SBM. 5 motor tankers loaded with bulk gas, INB, and PMS are also at the port waiting to berth. And that's the Shipping Position. Thanks for listening.
You've just listened to Shipping Position, brought to you by Lagos Traffic Radio 96.1 FM.
Mommy, Shade, this child looks sickly. Try and take her to the hospital. I wish I could, but the expenses are too much. Don't tell me you have not heard about LSHS ILERA EKO. ILERA EKO? What is that?
Lagos Health is our wealth. ILERA EKO.
Oh yes! Lagos State Health Management Agency, LASHMA, has designed an affordable and quality healthcare scheme for Lagos residents. In ILERA EKO, at your convenience, you can have access to antenatal, delivery, immunization, management of hypertension, diabetes and other illnesses, family planning and basic emergencies. Register with ILERA EKO branded agents and at the nearest ILERA EKO branded outlets. Pay 40,000 Naira annual subscription for a family package or 8,500 Naira for an individual package and start to experience peace of mind. For more information, call 0700 ILERA EKO or 0800 Ask Lashma or visit www.lashma.com. ILERA EKO, affordable and quality healthcare for Lagos residents.
Lagos Health is our wealth.
Lagos Traffic Radio 96.1 FM, and it's ILERA EKO Extra live. And we have with us in the studio Mr. Olusegun Braimo. He is an agent coordinator with the Lagos State Health Management Agency, LASHMA. And we have been discussing ILERA EKO coverage and the benefits, the things you definitely will get to enjoy if you come on board this scheme. Let me not say if, when you come on board this scheme. And of course, so much to be enjoyed. He has mentioned a whole lot, and he actually assured me that there's still a lot more, but because of time, we'll not go into all that. We have spoken about the standard plan, so feel free to be part of this. 080-991-20777. You can call in if you need any clarification. You can also call 091-538-77127. I'll keep repeating these numbers. We would love to hear from you if you need any clarification, if you need him to explain any part of this. Yes, of course, that will be amazing. Would want you to, call in or send in your questions via WhatsApp. 080-991-20777. I already have a question, Mr. Braimo. This is from WhatsApp. This question is, good morning, Mr. Akan Usen and your guest. I'm a retiree of 62 and my wife is also a retiree. We have children who are above 18. The youngest will clock 20 on the 15th of this month, while his elder brother will be 24 next month, God willing. He said the only surviving daughter is outside the country. I'm giving you these details to be able to advise me well on the amount to pay for registration and enrollment. Thanks. Anonymous, please. Okay.
Okay. Okay.
He was very detailed.
Yes.
I'm guessing it's a he. It was very, very detailed. Yes. So.
You're retired. You're above 60. Your spouse is also retired, above 60.
Yeah.
You could both go for the seniors plan.
Seniors plan. Okay.
However, if you feel you don't need the seniors plan, you could also go for a standard plus plan.
Okay.
Now, all plans are
for him and his wife.
Yes, for him and his wife. Now, for the last child that they said is just clocking 20, can be part of the standard plus plan. Okay. The seniors plan will just be for the principal and the spouse. Okay. So for him and his wife. Okay. The seniors plan, I think I'll just take the opportunity to explain what the seniors plan covers.
We'll just go into that.
So the seniors plan is everything about this.
So he sent a follow-up. My wife is 58 plus, but not up to 60.
Okay. I think that confirms that is a he.
Okay.
Okay. I'm happy that you're listening to us. Yes. And okay, let me just go straight to the point. You're already above 16.
Yeah.
So you are perfectly eligible to take on the seniors plan. Okay. The age of your wife is not an issue because she's your dependent.
Yeah, okay.
So both of you can be on the seniors plan. However, the seniors plan cannot accommodate your child because it's only for principal and spouse.
Okay, how does that work? Principal and spouse? I thought it was one person. Okay, the couples plan.
Yes,
okay,
that's seniors plan.
Okay,
yes,
yeah. The couples. Yeah.
Now, the reason why we call it seniors plan is because it's expected to be for people who are already above childbearing ages.
Okay.
So, and it also has, it's our only plan for now. that covers annual medical checkup.
Okay.
So once in a year, there's a list of tests that they could go run at their own demand.
Okay, so
As a matter of fact, there's let me call it an allowance
Okay.
that will put in place for people who are even below 60 as principals,
Okay.
who want the seniors plan because of its own uniqueness.
Okay.
Like I said,
I'm guessing this is new because we have been having a lot of questions as regards this. People who are not up to 60 but want to be part of this.
I think we put it in full effect, I think, middle last year.
Middle of last year, okay.
So people who are not even 60 can take up the seniors plan.
Okay.
Because, like I said, seniors plan is the only plan that we have that has provision for annual medical checkup.
Medical checkup, okay.
So there's a list of tests and scans that an elderly can go for once a year
Okay.
on their own demand. It doesn't have to be a doctor's prescription or recommended by any physician.
Yeah.
And they don't even get to do it in the hospital they chose. We have partnered with 3 test facilities currently: Afri Global, Clinics, and BT Diagnostics. So they can wake up this morning and say, oh, I want to go do my PSA, that's prostate-specific antigen for the men. They'll reach out to us, we'll book an appointment for them, and in less than 30 minutes, they can walk into the facility and have the test done, take the result back to the hospital they chose for further treatment. Now, that is not available for children because children cannot be part of the plan. That's why I said they can also pick up the Standard Plus plan. Now, the Standard Plus plan can accommodate children up until the age of 22.
Okay.
Once the child is 23, they'll stand alone.
They have to have a standalone plan.
Standalone plan,
Okay.
yes. Now, this is where it blurs.
So if he does say the Standard Plus, I think it might only cover the child who is
20.
2 o'clock 20.
Yes.
Okay.
The one who has already clocked 23, going on 24,
Yeah.
would have to register as a principal.
Standalone. Okay.
Now, this is the benefits of the Standard Plus plan. Some of the tests and scans for the seniors plan is also on the Standard Plus plan.
Okay.
The difference is a doctor has to prescribe it.
Okay. Not like the seniors
like-
plan where you can
You can
make a
demand
demand for it.
yes.
Okay.
So, for example, there's mammogram on Standard Plus plan, there's PSA on Standard Plus plan, there's pap smear on Standard Plus plan. But a doctor has to recommend it that, oh, you need to do these tests,
Okay.
and then to be done. So it's not something you can walk into the hospital and say, I want to do this as an early on the Standard Plus plan.
Okay.
So like I said, the standard plan, the seniors plan rather, is a combination of standard plan and annual medical checkup minus maternal care. Since you're not having children, then you don't need maternal care. Now, the Standard Plus plan is an upgrade of the standard plan.
Okay.
The seniors plan as it is 34,000 for an individual and 65,000 for a couple.
Okay. So there's a discount of some sort.
Yes.
Okay.
For the Standard Plus plan, it's 15,000 for an individual and 70,000 for a family.
So he's asking, he mentioned that he retired after 35 years of service while he served for 31 years. But he's asking how much is the Standard Plus to pay?
Okay, that's what I just said. The Standard
Yes.
Plus plan is 15,000 for an
15.
individual
Okay.
and 70,000 for a family.
For a family, okay.
However, because he served for 35 years, if he's recently retired,
Yes.
his policy couldn't have expired immediately. Because there's something we started last year, whereby for every public servant, every Lagos State public servant,
Yes.
have an extra year of ILERA EKO.
Okay.
So if it's, let's say his policy expired in December 31st, 2023, he still has another policy running 2024
Okay.
before he now has to pay.
Oh, okay. Okay.
For some very lucky few, their policy will be expiring this year. So the extra 1 year that Lashma is adding for them will kick off when their policy expires. So some of them, even after retirement, might still enjoy about some as much as a year and 10 months of ILERA EKO before they now have to pay.
Wow.
It's at that point they can now say, oh, I don't even want this plan, I want another one. But while we are giving them 1 extra year, they might even decide, oh, we want a higher plan. So while this one is running, we'll still want a higher one, and then they can always go for it.
So he said she just retired on the 5th of December while he retired in April 2021. So probably after now, would have to maybe you'd reach out.
Okay, that
to
would be
get
good.
all the details.
So we'll get their details and then we'll reach out to
Oh,
them.
great. That would be amazing. All right, thank you so much. Thank you so much for that. At this time, around the PWD traffic, let's just take a peek. Due to ongoing construction work on the BRT corridor, that's at Ikeja along Inwatile Zik, we have a flat body trailer belonging to ECC parked on the lane on the main carriageway to enable offloading of materials for construction works. We have traffic managers on ground to ensure ease of movement. Meanwhile, there's a backlog beyond Ikeja along, while Inward Airport bus stop from National is free down to Bolade or Shodi, respectively. All right, Mr. Olusegun Brahimo, let's move on with the rest of the program. We're talking about, we're through with the standard plus plan. We have spoken about the seniors plan somehow, you know. So let's touch on the rest of the plans.
Okay, so for the telemedicine plan, as the name implies, it is telemedicine.
Yeah.
We call it EKO Telemed. So an enrollee can register for the telemedicine plan, pay as low as 3,000 naira
Okay.
for an individual, covered for a year. And their major benefit is to speak with a doctor 24/7.
Okay.
That's just the major benefit.
Okay.
So they don't have to go to the hospital. They don't have to physically go and pick up drugs. However, for the telemedicine plan, drugs are not covered under ILERA EKO.
Okay.
So what you're paying for is teleconsultation. So you can speak with any doctor, whether a general practitioner or a specialist. If they recommend drugs, you would have to go and buy them.
By yourself, out of your pocket.
Yes, out of pocket. Though we are currently working out a relationship with some pharmacies where they can deliver to you, do at an extra cost for those who prefer such services. Now, for the family of the telemedicine, it's 14,000 for a whole year.
14. Okay.
14,000, family of 6.
Okay.
Now, the telemedicine also has its own mobile application available for the Apple Store and the Google Play Store.
Google Play Store. Okay.
So, in the event that you're speaking with a doctor and you need to show them something, maybe you're currently on a prescription and you need to show them, or there's let's say rashes or something. Let me use that as an example. That you need to show the doctor that, oh, this is what is on my skin. What do you recommend? Then the mobile application allows you to do a video call with them, so you can see who you're speaking with, and they can also see you and show you. Let's say they recommend a drug and you don't know what it looks like. They could snap it and send it to you via the mobile app, and then you see it.
Okay.
Now let's just move to the diaspora plan.
Diaspora plan. Okay.
The diaspora plan is designed for two categories of people.
Yeah.
Category number 1.
Yeah.
People who have relocated completely with their families, but still have relatives here that they cater for and wish to purchase ILERA EKO for them.
Okay.
So while they are abroad, they can purchase ILERA EKO over there and pay in whatever currency of where they live.
Okay.
So they can pay in dollars, they can pay in pounds, they can pay in euro. Now, for the second category,
Yeah.
those whose family have relocated but they are still here, or those who travel to and fro and wish to have a plan anytime they come around. So they can also pay in whatever currency, and they will always have access to diaspora plan. I think I just got a question for the telemedicine.
Yes.
So let me just repeat again. The telemedicine is 3,000 naira for
3,000,
an individual
Okay.
and 14,000 for a family.
Okay.
So continue with the diaspora plan.
Yeah.
The diaspora plan is a combination of the standard plus plan
Okay.
and telemedicine services.
Okay.
Now, the cherry on top of it is that the diaspora plan has its own unique list of hospitals. You know, because of the peculiarity of the clients that were expecting on the diaspora plan, we have added some hospitals just for them. So we've removed some hospitals from the list of people on diaspora plan. For example, for the hospital list for the diaspora plan, there's no primary healthcare center.
Oh, okay. I understand what you mean by that. Okay.
Now, the diaspora plan is in different currency, as I've explained, but I'll only be mentioning the naira.
Okay.
So for the diaspora plan, an individual will be paying 26,000 naira for a year. And for a family, it is 129,600.
Okay.
They can also pay in dollars, they can pay in pounds, they can pay in euro. For the dollars, for an individual, is $55 or 54 euro or $55, 45 pounds or 54 euro
Okay.
for an individual. And for the family is $270 or 220 pounds or 272 euro. Whichever country you're staying in the world, I'm sure you can have access to one of these three currencies per time. Everybody, most people have access to dollars, but no matter how it is, you can still have access to one of them. There should be an easy way to do the exchange, and then you can pay for your loved ones here. The reason why we added the Naira is because some people still maintain the Naira account,
Yeah.
even while they've traveled for
So
many
it'll be
years.
easy for them to just pay via
Yes.
the Naira option.
And then secondly, from our observation in the last few months,
Yes.
there are some people who are just in Nigeria. They've not traveled abroad, they've not relocated, but they just want the diaspora plan.
Okay. Okay.
They just want the diaspora plan.
For a certain reason.
Yes, so
okay.
they can also benefit
part of
from
this.
the diaspora plan.
Okay.
Now, the last benefit of the diaspora plan is a rider. Rider means it's an optional benefit, meaning
Yeah.
you can pay for it, and if you don't want it, you can leave it. And that's what we call the fortnightly visit by a home nurse.
Okay.
So every 2 weeks for the policy year, there will be a nurse that will check on you, whether it's an individual or it's a family. It's just a flat rate, and it is $515.
Okay.
Just a one-off payment for a year. But like I said, it's an optional benefit, so it's not compulsory that you pay for it.
Okay.
So that's it for the diaspora plan.
All right. Let's quickly touch on. You talked about the school and tertiary plan. Let's just touch on that.
So the school plan is for secondary schools and primary schools.
Okay.
The school plan is to be purchased by the school, not by the parents.
Okay.
So the parents can have a ILERA EKO plan, and the school can buy the school plan for the students. If a family has a plan, the hospital they chose, I'm sure, will be close to where they live.
Yeah.
It might not necessarily be close to where the school of the child is or the children are. So the school plan is for people who have HMOs or don't have, and then their children can have access to a proper hospital outside a sick bay if there's need for such. And the hospital the school can choose will be the one close to the school. It will reduce the calling the parents on emergency, oh, come and pick your child from our school where he's experiencing this or she's experiencing that. Now, the school plan can be paid termly
Okay.
or annually.
Okay.
So per term, it can be 2,000. It's 2,500 per child,
Okay.
and 7,500 annually. For the tertiary institution plan, is for high institutions of learning, polytechnic, university, colleges of education, and the rest. And it is also to be purchased by the school, not by the student, because the first criteria is to have a matriculation number. And the only way we can verify your matriculation number is if the school is the one supplying it to us. And for the tertiary institution plan, is 5,000 naira
5,000
per student.
per student. Okay, so let's just talk about how and where we can register together, even as we round up on the show.
Okay, to register, you can call any of our toll-free lines
Okay.
or our sales hotline, which is 0700 ILERA EKO. That's 0700
Okay.
453
453
723
723
56.
56.
I'll
Okay.
take that again. 0700 453 723 56. You can also chat us on WhatsApp at 070 453 582 75. That's 070 453 582 75 for WhatsApp only. And if you're close to any of our divisional offices, we have 5 divisional offices. Our Ikeja division is at Ikoto Igondo LCDA.
Okay.
And the phone number of the coordinator, that's the person in charge of that division, Mrs. Steve, is 0903 271 4720. For our Badagry division, that's within Badagry General Hospital,
Yeah.
is Mr. Ebenezer. You can reach him on 0903 525 8842. For our Ikorodu division within Ikorodu General Hospital, that's Mr. Adeolu. You can reach him on 0903 4797 089. Our Lagos division, manned by Mr. Olamide, within the Maternal and Child Center at Etiosa, Ogombo. You can reach him on 0803 415 9849. Last but not the least is our Ekpe division, which is manned by Mr. Afiz. That's opposite the legal area, the magistrate court. You can reach him on 0702 585 4777.
All right, we have come to the end of the show. We can go on and on. I know I still have a lot of questions that I want to ask, but sadly, time is not our friend. Mr. Brimo, thank you so much for coming around.
Oh, it's always a pleasure.
Yes, always a pleasure. Looking forward to more editions of the show with you as our guest. And yes, dear listener, it's been a great time on the show. And a quote says, "The greatest wealth is health." This quote was by ancient Roman poet, which of course reminds us that no matter what your financial or material possessions may be, your health is your most valuable asset. It's essential to take care of yourself and prioritize your well-being if you want to lead a happy and fulfilling life. Get yourself an ILERA EKO plan. A big thank you to Victor Oteri. Also, many thanks to Adeyinka Bemiwade and yes, PAO Lashma. Also, big ups to Halima right here in the studio with us. Great job you're doing. Till we get to hear from us again, it's goodbye and God bless you. My name is Akan Usen.